All right, I'm in chapter 81 now. We're going to talk about Cushing's disease or syndrome. This is where you have too much cortisol in the body. So let's talk about kind of the cortisol pathway. So hypothalamus produces CRH, which in reaction to that CRH, the anterior pituitary gland produces ACTH, and in response to the ACTH, then the adrenal cortex produces cortisol. So if there's too much cortisol going on, it's due to one of these, it can be due to one of these three organs not doing its job right. So the adrenal cortex, if it has like a tumor there or hyperplasia or something else wrong, then it may just produce too much cortisol regardless of the levels of ACTH coming from the anterior pituitary gland. Or you can have an issue with the pituitary gland, right? If there's like a tumor or something there, then it may produce too much ACTH, which in turn will cause the adrenal gland to produce too much cortisol. And of course, you could also have an issue with the hypothalamus, but we're not going to really focus on that one in this chapter. So you can have an issue with the pituitary gland. You can have an issue with the adrenal cortex. The other cause of Cushing's syndrome or disease is due to long-term glucocorticoid use. So for patients who have like autoimmune disorders, inflammatory disorders where they have to take these long-term steroids, then they can end up with Cushing's syndrome also. So let's talk about some of the symptoms of Cushing's disease. And these are really important to know. And again, it's due to too much cortisol in the body. So when you think about like what the symptoms are, I want you to think about like, okay, what are the side effects of steroids? And that's something we've talked about in previous videos and maybe you're familiar with. It's going to look a lot of the symptoms are going to be very similar to those symptoms. So the patients are going to experience fatigue. They're going to have joint pain. Depression is also really common. They will have increased incidence of infection. Again, that's like the same as someone who is on steroids. They will have thin, fragile skin. They will exhibit hypertension because they're retaining lots of sodium and water, and so this is causing edema and hypertension. They'll have tachycardia. They may have gastric ulcers, weight gain, which we kind of mentioned there, and then dependent edema. So they will often have like with a moon face, truncal obesity, and they'll have what's called like a buffalo hump. So they'll have like excess, like an excess fat collection on the back of their neck. So if you want to see what that looks like, then Google it. It's very distinctive. They may exhibit fractures and bone pain. Just like with steroids, you end up with bone loss is a big side effect there. So when you have too much cortisol, it's like having too much steroids. Impaired glucose tolerance, so you might see hyperglycemia, and then they may have like some unusual hair growth and then acne. So those are some symptoms of Cushing's disease. I would definitely look over that list and know that. The other thing that's super important to know with this chapter, and I mean super duper important, are lab levels, okay? So make sure you know your lab levels, what's up and down with Cushing's disease versus what is up and down with Addison's disease. So cortisol levels will be increased. So salivary cortisol levels can be taken, and that is used to confirm a diagnosis of Cushing's disease. Potassium and calcium levels will be decreased in Cushing's disease. Glucose levels and sodium levels will be increased with Cushing's disease. You can also do, we talked about in a couple chapters ago, the dexamethasone suppression test. So I won't cover it here again, but that's also a diagnostic tool used to diagnose Cushing's disease. So in terms of nursing care, we definitely want to get a dietitian involved. We want the patient to decrease their sodium intake and increase their intake of potassium, protein, and calcium. We want to maintain a safe environment because they may have fractures and they have bone loss. They're at high risk for hurting themselves if they fall. So you want to basically minimize risk factors associated with them falling. So just maintain a safe environment. You want to prevent infections, so frequent hand hygiene, that type of thing, meticulous skin care. And then in terms of medications or other interventions, This chapter goes over a number of adrenal corticosteroid inhibitors, medications that I wouldn't necessarily waste time with. I don't find that ATI asks about those a lot. I would know that spironolactone is a diuretic that is a potassium-sparing diuretic. So again, we want to increase levels of potassium and get rid of that excess water and sodium. So spironolactone is a good way to do that. If the Cushing's disease is caused by a tumor, either in the adrenal gland or the pituitary gland, then you may need to have the patient undergo chemotherapy or some other cytotoxic agent to deal with that. If you need to remove the pituitary gland due to a tumor, so that would be called a hypophysectomy, I would be familiar with some of the nursing care items for a patient who has undergone a hypophysectomy. So in particular, I would know that you need to assess the drainage that they may have coming out of their nose for the presence of glucose or a halo sign. So a halo sign is where you have yellow on the edge and clear in the middle, and that can indicate the presence of cerebrospinal fluid in that drainage, which would be a big complication. So definitely no halo sign. You're going to be assessing that nasal drainage for halo sign and for the presence of glucose. You want to advise your patient to avoid coughing, blowing their nose, or sneezing. They may have a diminished sense of smell for 3 to 4 months after surgery. They should avoid bending over at the waist and straining in any way to prevent increased intracranial pressure. So you may need to give them like a stool softener or whatever so they're not like straining when they're going to the bathroom. They should avoid brushing their teeth for 2 weeks. However, they can floss and rinse their mouth. If they taste kind of like a sweet smelling or sweet tasting drainage, like postnasal drip, they need to notify their provider right away because that can indicate the presence of glucose in that drainage. And then we talked about how to avoid constipation. They may also, if the issue is with the adrenal cortex, they may need to have an adrenalectomy. If they do end up having an adrenalectomy, then they will need to have glucocorticoid and hormone replacements pretty much for the rest of their life. And then you want to monitor for an adrenal crisis, which happens if you have this sharp drop off in cortisol. So if your adrenal gland is producing all this cortisol and then they're like taking it out via surgery, then you have to kind of worry about the other end of the spectrum, which is not enough cortisol in the body. So those are the main points of this chapter. Again, I would really be familiar with the symptoms of Cushing's disease, the lab values, what's up and down, and then if they have to have a hypophysectomy, I would definitely know about the glucose and halo sign to be on the watch out for. Hopefully that's helpful, and we'll talk about Addison's disease next. Thanks.